So I have another top cardiologist, Dr. Srinath Reddy, for whom I have very high regard. He's a cardiologist, global public health leader who set up the Public Health Foundation of India. He's been a champion and a guide to many across the world. Dr. Srinath Reddy.
Thank you very much. It's been a very enriching discussion so far. Indeed, if we really look at digital health, it has a transformational capacity in multiple areas, certainly in terms of advancing knowledge in several disciplines and integrating them for improving patient care, but also public health in very many dimensions. It actually advances elucidatory and implementation science. We know that there is knowledge created in multiple disciplines, but that is not really put together to understand the varied determinants of health which interact to produce disease or can contribute to health. The example given by the International Diabetes Federation president that even online shopping is a good predictor of future diabetes is an example of this. So when we have to integrate knowledge from multiple disciplines, from molecules to markets, then obviously digital health is going to be very important with its broad coverage. We also know that when we have to look at the several determinants of health and look at how the metagenome interacts with the deep phenotype to produce a variety of gene-environmental interactions, we cannot actually be guided only by the knowledge that's been created in few select populations across the world, or on the algorithms that have been so selectively developed in them. We have to really study the huge diversity of social, environmental conditions across a variety of gene pools across the world if we have to really enhance our scientific knowledge about what causes disease and how best we can promote health. India is a case in example with a very large diversity, not only of geography, but also of genetic pools, of dietary patterns, and of course, of our health systems. And therefore, it's important for us to harness that knowledge for the benefit of all of humanity by advancing science. Indeed, digital health can greatly democratize science. Already it's been mentioned about a variety of healthcare providers who can be engaged in it. But we must understand that we're also empowering people, persons, and communities for self-care, for assisted care, for community-supported care. And therefore, there is a whole host of healthcare providers who can actually be brought together. And even in health professional education, we can actually build teams rather than educate nurses in isolation or doctors in isolation, because ultimately good health services depend upon good teamwork. And similarly, in public health too, a very strong engagement of multiple providers of public health services, including the community, is going to be absolutely important. So I would like to really say, along with Dr. Zeltner, that we must ensure that there is digital comfort and confidence across all ages, in all people, if we have to utilize the strength of digital health very well. Also, we must ensure that we are not subverted in this effort by digital hypernationalism, which actually creates fresh borders through proprietary science. Public purpose should not be shackled by proprietary science. So that's absolutely important, that we must pay attention to that as well. But very importantly, I would like to say that it's not just digital health sans borders across countries, but it's also digital health sans barriers within countries. We must ensure that barriers, whether they exist between different levels of care, different types of healthcare providers, or different types of healthcare systems that exist, all those barriers are also removed by appropriate and timely adoption of digital health. And that's going to be a very important challenge for us within each of the countries, even as we try and bridge the barriers and break the silos within disciplines and also ensure that we have no barriers between countries as well. And I believe that what has been called for as a fusion of vision, values, and vigor is going to be the prescription for advancing digital health to new frontiers. Thank you.
Thanks, Dr. Reddy, and you made very important points, and we hope we'll continue to get your guidance. I don't want to stop you from caffeine. Coffee is outside, so you can grab and come.